Psychiatric rehabilitation. Psychiatric rehabilitation, also known as psychosocial rehabilitation and sometimes simplified to psych rehab by providers, is the process of restoration of community functioning and well-being of an individual diagnosed in mental health or emotional disorder and who may be considered to have a psychiatric disability. Society affects the psychology of an individual by setting a number of rules, expectations, and laws. Psychiatric rehabilitation work is undertaken by rehabilitation counselors, especially the individuals educated in psychiatric rehabilitation, licensed professional counselors who work in the mental health field, psych rehab consultants or specialists in private businesses, university-level masters and PhD levels, classes of related disciplines. These workers seek to effect changes in a person's environment and in a person's ability to deal with his/her environment, so as to facilitate improvement in symptoms or personal distress and life outcomes. These services often combine pharmacologic treatment often required for program admission, independent living and social skills training, psychological support to clients and their families, housing, vocational rehabilitation and employment, social support and network enhancement, and access to leisure activities. The key role of professionals to generate insight about the illness with the help of demonstration of symptoms and prognosis to the patients. There is often a focus on challenging stigma and prejudice to enable social inclusion, on working collaboratively in order to empower clients, and sometimes on a goal of full recovery. The latter is now widely known as a recovery approach or model. Recovery is a process rather than an outcome. It is a personal journey that is about the rediscovery of self in the process of learning to live with the debilitations of the illness rather than being defined by illness, with hope, planning, and community engagement. Yet, new in these fields is a person-centered approach to recovery and client-centered therapy based upon Carl Rogers and user service direction as approved in the U.S. by the Centers for Medicare and Medicaid Services. Definition and definition. Psychiatric rehabilitation is not a practice but a field of academic study or discipline, similar to social work or political science. Other definitions may place it as a specialty of community rehabilitation or physical medicine and rehabilitation. It is aligned with the community support development of the National Institute on Mental Health, begun in the 1970s, and is marked by a rigorous tradition of research, training, and technical assistance and information dissemination regarding a critical population group, e.g., psychiatric disability in the U.S. and worldwide. The field is responsible for developing and testing new models of community service for this population group. The Psychiatric Rehabilitation Association provides this definition of psychiatric rehabilitation. Psychiatric rehabilitation promotes recovery, full community integration, and improved quality of life for persons who have been diagnosed with any mental health condition that seriously impairs their ability to lead meaningful lives. Psychiatric rehabilitation services are collaborative, person-directed, and individualized. These services are an essential element of the healthcare and human services spectrum and should be evidence-based. They focus on helping individuals develop skills and access resources needed to increase their capacity to be successful and satisfied in the living, working, learning, and social environments of their choice. The term was added to the U.S. National Library of Medicine's medical subject headings in 2016. There, psychiatric rehabilitation is defined as a specialty field that promotes recovery, community functioning, and increased well-being of individuals diagnosed with mental disorders that impair their ability to live meaningful lives. History. From the 1960s and 1970s, the process of deinstitutionalization meant that many more individuals with mental health problems were able to live in their communities rather than being confined to mental institutions. Medication and psychotherapy were the two major treatment approaches, with little attention given to supporting and facilitating daily functioning and social interaction. Therapeutic interventions often had little impact on daily living, socialization, and work opportunities. There were often barriers to social inclusion in the form of stigma and prejudice. Psychiatric rehabilitation work emerged with the aim of helping the community integration and independence of individuals with mental health problems. Psychiatric rehabilitation and psychosocial rehabilitation became used interchangeably as terms for the same practice. These approaches may merge with or conflict with approaches based in the psychiatric survivors movement, including the concept of user-controlled personal assistance services. In the 1980s, the U.S. Department of Education National Institute on Disability Research and Rehabilitation revised a rehabilitation research and training center program. A priority center, published in the Federal Register, was the Rehabilitation Research and Training Center in Psychiatric Disabilities awarded to William Antony's Boston University Center. As of 2015, it remains a priority center, providing nationwide assistance and serving as flagship center internationally. With the founding of Psychosocial Rehabilitation Canada in 2004, the professional organization International Association of Psychosocial Rehabilitation Services IAPSRS changed its name to United States Psychiatric Rehabilitation Association USPRA, and the trend is toward the yin. In 2013, USPRA removed the national designation from its name, becoming the Psychiatric Rehabilitation Association PRA. Academic discipline. In 2012, Temple University was funded in the field of psychiatric disabilities for a national center with the National Institute on Disability and Rehabilitation Research NID. Boston University's Center on Psychiatric Rehabilitation's director is president-elect of the NART program, and Boston University College of Health and Rehabilitation Sciences Sargent College awards a rehab master program in psychiatric rehabilitation, was part of an MA degree in rehabilitation counseling in the School of Education, Syracuse University, and courses were funded in part through the Federal Rehabilitation Research and Training Program, now part of National Institute on Disability, Independent Living, and Rehabilitation Research. Theory. Principles. The mission of psychiatric rehabilitation is to enable with best practices of illness management, psychosocial functioning, and personal satisfaction. Treatments and practices towards this is guided by principles. There are 7 strategic principles. Enabling a normal life. Advocating structural changes for improved accessibility to pharmacological services and availability of psychosocial services. Person-centered treatment. Actively involving support systems. Coordination of efficient services. Strength-based approach. Rehabilitation isn't time-specific but goal-specific in succeeding. The peer-provider approach is among the psychosocial rehabilitation practices guided by these principles. Recovery through rehabilitation is defined possible without complete remission of their illness. It is geared towards aiding the individual in attaining optimum mental health and well-being. Services. Psychiatric rehabilitation services may include community residential services, workplace accommodations, supported employment or education, social firms, assertive community treatment, or outreach teams assisting with social service agencies, medication management e.g. self-medication training and support, housing, program. Traditionally, 24-hour service programs supervised and regulated options were based upon the concept of instrumental and daily living skills as formulated in the World Health Organization WHO definition. Psychiatric rehabilitation is illustrated by agency models which are offered by traditional and non-traditional service providers and may be considered to be integrated, e.g. dispersed sites in the community, or segregated, e.g. campus-based facilities or villages. E.g. Fountain House model of New York City, MHA Village in Long Beach, CA, or Transitional Living Services of Buffalo, or Transitional Living Services of Onondaga County, New York. Agencies supporting integration may align with normalization or integration philosophy, as opposed to the older sheltered workshop or day care models which have been criticized for underpayment of wages at the U.S. congressional level in the late 2000s. Agencies may deliver cross-field best practices, e.g. supported work, consumer voices, e.g. Ray Unzicker, multiple disabilities, e.g. chemical dependency, training of its own community residential employment, education and support service professionals, rehabilitation outcomes and management and evaluation. Core principles of effective psychiatric rehabilitation: how services are delivered must include providing hope when the client lacks it, respect for the client wherever they are in the recovery process, empowering the client, teaching the client wellness planning, and emphasizing the importance for the client to develop social support networks. Psychiatric rehabilitation: what services are delivered varies by provider and may consist of 8 main areas: psychiatric symptom management, relaxation, meditation and massage, support groups and in-home assistance, health and medical, maintaining consistency of care, family physician and mental health counseling, housing, safe environments, supported housing, community residential services, group homes, apartment living, basic living skills, personal hygiene or personal care, preparing and sharing meals, home and travel safety and skills, goal and life planning, chores and group decision-making, shopping and appointments, social relationships, recreational and hobby, family and friends, housemates and boundaries, communications and community integration, vocational and / or educational vocational planning, transportation assistance to employment, preparation programs, e.g. calculators, GED classes, televised education, coping skills, motivation, financial personal budget, planning for own apartment, startup funds, security deposit, household grocery, social security, disability, banking accounts, savings or travel, community and legal resources, health insurance, community recreation, memberships, legal aid society, homeownership agencies, community colleges, houses of worship, ethnic activities and clubs, employment presentations, hobby clubs, special interest stores, summer city schedules. As of 2013, it is expected modernization in these fields includes better health care, such as women and men's health, e.g. heart disease, public and private counseling services in mental health, integrated services for dual and multiple diagnoses, new specialized treatments, e.g. eating disorders and understanding of trauma services and mental health. Psychiatric rehabilitation is typically associated with long-term services and supports LTSs in the community, including post-secondary education as supported education. Educational and professional organizations. Canada. In Canada, psychosocial rehabilitation / readaptation psychosocial PSR/RPS Canada promotes education, research and knowledge exchange in relation to evidence-based psychosocial rehabilitation and recovery-oriented practices for service providers and those receiving services for mental health challenges. A framework of competencies for service providers, individuals, and organizations was developed and announced at the 2013 Annual National Conference in Winnipeg, Manitoba. United States. Boston University Center for Psychiatric Rehabilitation, Psychiatric Rehabilitation Association, formerly the United States Psychiatric Rehabilitation Association and International Association for Psychosocial Rehabilitation, a professional organization founded in 1975. Rutgers School of Health-Related Professions, Department of Psychiatric Rehabilitation and Counseling Professions.